we get ours from Mayer's Distributing, okay, which is fantastic. But you can get a lot of them at sporting goods stores. And just make sure that they're thin enough. The ones that we use are only 4 inches in width, and they have a double pull. So one Velcro hits it, then the other two pull even tighter to lock it in. I've had patients that have used a scarf, okay, where they tie it really, really tight. Now, it's only going to be used when you're standing or walking. It won't do any harm if you were sitting, except it can compress the nerves on the side. But there's a number of different varieties out there, and they only cost around $10 to $15, and they're fantastic. But the key is, when you're using a trochanter support, you got to be addressing the underlying cause, which is going to be pelvic instability. And so how do you correct the actual cause? You got to look at the biomechanics of the feet, the knees, the calf flexibility. You got to look at the lumbar, because there's never a pelvis that's going to have an issue if you have a good lumbar. And then also, if you have a lateral thoracic deviation, there's going to be that as a contributing factor. So you got to look at the entire structure. Even forward head carriage can flatten out the curve in the low back. So look at the entire structure. And as long as you're addressing all the underlying contributing factors and causes, then you should only need that belt for, say, a month and a half at the most. If you have a consistent trauma like past surgery or some type of scoliosis or some other kind of pathologies in the lumbar spine, you may need it longer. That's why, you may need to get a couple of these belts, but they are fantastic and they work really, really well. But you can use anything to approximate those hips. And once you find it, just get a couple of them. But once you stabilize that pelvis and you're addressing the underlying causes, you won't need it that long. They're really, really cool. But address the calf, foot biomechanics, knee biomechanics, everything.